I am Serena Soria. I am one of the occupational therapists in the district. I work at Roosevelt and at Kennedy, and I'll let the other OTs introduce themselves too.
Hello, my name is Zoe Walt. I'm another OT, and I am at Taft and Clifford this year.
Hi there, my name's Mariana Sinakis. I'm an occupational therapist who works at Hoover, Garfield, and Orion.
All right, and tonight we will be here presenting understanding sensory processing at school and at home. Um, There we go. So just to introduce some things, so we are occupational therapists in the district. We are school-based occupational therapists. And in school, we help students with their fine motor needs and supporting their sensory needs at school if those things impact them accessing their education, which Zoe will kind of go more in depth about the differences between school-based OT and OT in different settings. But the topics for tonight, we are occupational therapists, like we said. We will be going over the different sensory systems, school-based strategies, and home-based strategies. And I will let Zoe take it away.
Okay, so I am just going to review the school-based versus the medical model. There's a lot on this slide, but it's not that complicated. So in school, what we aim to do is help students regulate sensory information so that they can be as independent as possible in accessing their curriculum. So that may look like help with like auditory regulation or tactile or visual, and then some other systems as well, which we will get into. The medical model, they do the same thing in helping regulate incoming sensory regulation, but the end result is different. So they really strive to help the kids be as independent with self-care skills, such as dressing and eating and bathing. And as we go through, we will get more into detail with how this works. Um, some of you may have heard of sensory integration therapy, which is primarily used in a clinic-based setting. So they in this therapy, they help. It's through different protocols. They help children regulate sensory information. And due to the time needed to accurately do this and efficiently do this, as well as the various sorts of protocols, we don't provide this in school. It's primarily clinic-based. Yeah, so we can go on, and then we will have questions at the end if anyone has questions.
Perfect. So I'm going to go over sensory processing. So this is the idea and basically the overall concept of what happens when we get sensory input from our environment. So sensory processing involves how sensations are detected and transmitted to the central nervous system. The brain processes and arranges incoming information to generate appropriate bodily reactions, perceptions, emotions, and thoughts, allowing individuals to interact effectively with their surroundings. Sensory processing difficulties are commonly seen with the diagnosis of ADHD, autism, or physical disabilities. However, children, young people, and adults can also have sensory processing differences with no other underlying diagnosis. So we see here with our graph, we do have a sensory input, whether it be the, sun coming in through the windows, whether it's noise, anything else. We take that in from our environment. Our body has various systems that processes it and develops a system. And we're going to explain a little bit further how these can be typical or they can have a difference, which does impact your response to those.
All right. So this next slide is talking about neurodiversity affirming. So this is a slide that we wanted to touch on. There is a movement about neurodiversity affirming, and if you haven't heard about what that is, it is basically a movement focusing on shifting away from thinking that different learners, neurodivergent students or children, um, whatever differences they have are deficits that need to be quote unquote fixed. So when we're talking about sensory, we're not looking at sensory differences as things that we need to fix in a child. Um, like this could be something like, we're not stopping a child from stimming if that's regulating for them. We're not forcing them not to use their headphones if we know that is something that is supportive and regulating and a helpful tool for them. So neurodiversity affirming is about being strength-based. So we talk about a student's strengths and use their strengths and those kind of things to approach uh, sensory processing, specifically what we'll talk about today. And the other big thing about neurodiversity affirming is respect. So the principles are focusing on autonomy, agency, dignity, and self-determination, as well as acceptance. So this is mostly about how we are taking our students into consideration and what their preferences are, not just us thinking, oh, we think this might work for you. We're gonna really have you try it. We know that'll work for you. If they tell us they don't like something, we respect that. If they do like something, we respect that. And we just accept them for who they are. So if they have any kind of sensory difference, that we can support them with, then we will. So that is just something we wanted to touch on as we talk about neurodiverse learners and sensory processing needs tonight. All right. So as we get started, we are going to do a little activity. I really can't figure out this Zoom screen, but if you guys can, we have a couple questions for you that we would like you to answer in the chat. So we want you to think about something that you did to self-regulate when you were a kid, when you were a student. Um, this could be like when I was younger, maybe I was a nail biter. That's how I really regulated myself at school. Some people chewed gum. Some people went really hard at kickball at recess to regulate when they were a kid. So if you guys don't mind, kind of take a second to reflect and tell us what was something that you did to regulate when you were a student. All right, we got some leg shaking, chewing on pencil. Yeah, that is one we hear a lot. Picking at fingernails. I still do that. Playing with hair, biting nails, yeah, shaking leg. So these are a lot of the ones that we hear when we do this kind of presentation and talk to a lot of adults when they think about what they kind of did as a kid to regulate. Especially probably when you were back in school, there wasn't a lot of big focus on, movement breaks, brain breaks, sensory breaks, having these kind of tools that we have access to now to help support students with. So thank you. Next part of our activity, we would like to ask you, how do you self-regulate now as an adult? So I think there are some habits where some people are really into listening to a podcast now to help focus when they're at work. Maybe you go and take a walk in the middle of your day, things like that. Same way, yeah, old habits die hard, right? Humming. I feel like I probably do that without even knowing. Deep breaths, yeah, that's a good one. think as adults, we get a little bit better at taking in those breaths, being mindful. Lo-fi music. Oh, yeah, that's very popular now. Walking. Nice. Ooh, Zumba. Those are fun. Awesome. Well, we just wanted to take this moment for you guys to reflect on what activities that you do, what you did as a kid. So when we're talking about students, and you can think about your learner as well, um, maybe you'll kind of recognize that the things that we're seeing in them that might look like sensory seeking, sensory avoidance, sensitivity, might be their way at attempting to regulate themselves. So I'll pass it to Mariana.
Thank you. Okay, so before we delve into it, we're going to have to ask for another little participation. How many senses do we have, everybody? Please feel free to put it down in the chat. So before we go through it,
8 senses?
okay. Anybody else? Any takers? Let's see. Okay, so we have 8, we have 6. So there is there we go. Okay. So we have different answers. We'll have to find out which is which. Perfect. Okay, feel free to go forward with that.
Okay, so I will briefly review the senses. So the 5 that are most common are visual, olfactory or smell, gustatory, which is taste, tactile, which is how we regulate, say, like our clothes, like just different tactile sensations, like our clothes on our body, or like getting our hair brushed. Vestibular, you may or may not know, it's the balance coordination sense. So sort of regulating how we balance ourselves and combined with movement. And then there's also proprioception, which is really our ability to determine where our joints are in space. And then interoception, which is a not as well known, that really gives us an idea of when we're hungry or when we're thirsty or when we may need to use the bathroom. So to make it a little bit simpler, we're going to go to a little video for you to watch to explain it more. Yeah.
Okay, give me 1 second. Hmm. Well, now it's not letting me do the subtitles. All right. We are going to watch a little video that will hopefully help you guys to understand more. I'm going to try to see. Man, 5 minutes ago it let us do the Spanish subtitles, so sorry, Itzel and Nora.
We have 8 senses. 5 you have probably heard of: sight, sound, smell, taste, and touch. And 3 that you may not be familiar with. The vestibular sense, sometimes known as the gravity or balance sense, allows us to move smoothly. It helps us with balance while we walk and run, and to stay upright when we sit and stand. Proprioception is the sense of self-movement, force, and body position. It is present in every muscle movement you have. Without proprioception, you wouldn't be able to move without thinking about your next step. Interoception helps you understand and feel what's going on inside your body. For example, when you're hungry, thirsty, in pain, or need the toilet. Imagine for each of our 8 senses, we have a cup. And for us to feel regulated, each cup needs to be full. Each time we get some sensory input for one of our senses, it fills up the cup a little. For each sense, some of us have big cups and some of us have small cups. Imagine you have a small cup for sound. It fills up quickly with a little noise, and any more can feel overwhelming. Imagine you have a big cup for proprioception. You will need lots of movement to feel regulated. Understanding someone's sensory profile is really important in order to know what they need to feel, learn, and perform at their best.
Oh man, okay. Give me 1 second. We do not use Zoom in the district. We use Google Meet, and so it is a very big learning curve here today for me. 1 second. Marianne and Zoe, if you would like to chat about the video we just watched while I figure out my screen, that would be great.
Absolutely. So the video does just have a various kind of breaking it down. We're going to go more into the ideology of like the cups, and Zoe's going to explain it a little bit more. And it's kind of just giving some general ideas. Does anybody have any questions about that? Feel free to. And if we don't have questions, that's okay. Because we found out how to present.
Okay. Oh, okay. I will go over the small versus bigger cup. So if take the sensation of messy substances, okay? So some kids and adults might be hyposensitive to, say, even like a little bit of marker on their crayon. And so in that situation, their cup would be very, like, they would have a small cup for that sensation. Whereas other students might not even notice. So they might, play in the yard and then they might play in the yard and then get mud all over them and then just go about their day without noticing. So but I would say that for every sensation, a kid might have different cup sizes. So like you might be super, you might be tactilely like under responsive and have a large cup, but then maybe more sensitive to sound. So I think it's important to remember that. So like a sensory seeker might like move a lot to get that proprioceptive cup filled, and then an avoider might not, right? So it'd be the opposite end of the spectrum. But it's important to note that for every person and kid, each sense has a different threshold. So it's like when we work in schools, it's important to note that for us. Yeah.
Okay, so the first one
Yeah.
we're going to go over here is going to be vision, so sight, visual. So for this, like we were saying, we do have the under responsive and we do have the over responsive. So say an individual does not really notice things going around in their environment. They're often slow to react. They do need a lot of stimulus. So say like a lot of like lights, various things like that. They just take a lot more in order to register. So what we have here would say like individuals may spin their own bodies. They might stare at bright lights or flickering lights. They can move or shake their head while reading just to get that extra there. They can spin or rotate objects. So again, they're seeking that extra visual input. As for an individual who's hypersensitive or over-responsive to visual stimulus, They may withdraw from light sources. So maybe you'll see squinting or kind of just like really sticking to darker areas. They may struggle with eye contact. It just might be too much of that connection there and that too much of that visual stimulus. They could miss visual cues. And they also could tilt their head while focusing. And those are major things that we see with both the hyposensitive and the hypersensitive. So we have some strategies here. So for our hyposensitive people, and to clarify, do we want to answer questions as we go or at the end?
It's up to you guys. Yeah, there's been a couple of questions in the chat. Do you want me to read them?
I can read them. Or
Um,
we can also, yeah, just so we know what they're related to. Thank you, though.
One question was about the cup sizes. Does the cup size change over time? Or is it from month to month or triggered by something? That's the first question.
Absolutely. And that's a really good question. And I think then we'll go back to like the more specific ones towards the end. But for this one, it is kind of, if you think about all a component of how you personally feel. Are you sleeping enough? Are you getting enough nutrients? Are you following a routine? So it's just like any individual, all of our cup sizes do vary upon time. Some of us have sensitivities that are always consistent. However, if we're in a good mood, we have a higher tolerance for, say, an alarm that's going off. If we're in a bad mood, it's that alarm going off, it's somebody clicking their nails, it's those things that all of a sudden can really reduce that cup size. So it is quite variable. But we do have patterns in various behaviors, and that's what we usually base off things. So then we'll go and come back kind of to the general questions for the more specific at the end. So we'll go through all of these ones and then we'll answer the questions if that's okay. Perfect. So for our hyposensitive individuals, these are strategies here. We can use hand gestures and visual aids. So we're increasing that kind of awareness there. We can utilize puppets, vibrant colors, and dynamic movements. For hypersensitive individuals, so too much, we can encourage the resting, close your eyes, take a little break from all of the sensations coming in. We can reduce clutter, use natural lighting and minimize glare. A lot of the time we have the LEDs that are put in, the cool lighting, the overhead lighting can impact a lot of individuals differently. I'm sure we've all been in an office where the overhead lighting just gives you a migraine. We can decrease visual stimulation and use clear boxes for item retrieval. So then we come to addressing visual in the school as well as in home. So at the school, what we try and do is we do decrease clutter on worksheets. So that's a strategy that we do. So we will recommend decreasing the amount of problems on a page or writing on a page that's needed. We can dim the lighting when students work. So again, like maybe we'll use a chalk pad over a light to make a nice blue lighting versus the harsh lighting that's usually in classrooms, just because it is very economical. We can utilize desk dividers. That helps to kind of keep them more zoned in, as well as giving just that needed focus. This can also look like in the home. So we can also dim lighting in the home. If we're seeing that maybe their cup is quite full or we're seeing there's too much visual input, dimmer lighting can have less of that impact. We can use sunglasses outside. We can close the shade and open the shades during day, depending on the time and the light coming in. And we can also use like softer lights at dinner, say like candles, or like instead of overhead lighting, an accent light, just to ensure that we're keeping a steady need and meeting them where they're at for the visual input.
All right. And to answer the question that just popped in the chat, the strategies that are listed are for both types. So there's kind of a mix, but if you have specific question, we'd be happy to answer at the end. All right, so the next one we are going to cover is olfactory, or your sense of smell. So hyposensitivity to smells or under responsiveness we typically see kids who are sniffing objects or are attracted to strong odors. So when we have kids that are under responsive to a sensation or type of stimuli, we're kind of seeing them seek things out. So if you have a kid that's often trying to smell things or to smell you, lean in your clothes to smell you. Sometimes we have students that will seek out those stronger scents, maybe want to like wash their hands with the soap so that they can smell that scent over and over again. For hypersensitivity, so over responsiveness, this is when we see kids who might be more avoidant or more sensitive to these kind of smells. So they will often be distracted by different scents. They might be gagging or nauseous when usually food, unpreferred foods are presented or in close proximity to them. So meal times are often difficult. Um, and those are the big ones that we see with this specific sense. The strategies for each include for our kids that are kind of seeking out these kind of smells, we often give them scented Play-Doh and safe sensory stimulation. So that could be like different essential oils that are safely presented to them. This could be their favorite scents presented again in a safe way that's not going to be super overstimulating to them or them kind of smelling something over and over again that might like make them dizzy or, you know, affect them in that kind of way. Scratch and sniff stickers are great to give that input that they can kind of scratch it and they get that stronger scent if they want it. And different lotions are always a good strategy if they will tolerate wearing that and wanting that specific scent. For kids who are hypersensitive, so usually more over-responsive and avoidant of smells, we want to minimize their exposure to strong smells. So avoiding wearing like scents around them, perfumes, reducing things maybe in the home or school setting that we can that is strongly scented if it's really affecting them. Different coping strategies. So this might also look like different kind of distractions if they are going into a setting like maybe out in the community where we aren't going to be able to really avoid all of the scents that might be triggering to them. So giving them some different strategies of maybe a preferred scent that they might like or a fan in their face so that they're not smelling that if it's, you know, something that's going to be really upsetting or triggering for them. Introducing smells gradually through different play or like sensory bins or different like scented little chapsticks or something. We can slowly introduce smells to a kid to help them, you know, tolerate it if they're open to it. Again, we're not going to force them if it is something that is very triggering for them or upsetting to them. But we can use those different kind of tactics to introduce new smells slowly and gradually. And then again, avoiding strong perfume, that is one that usually the adults will do if we know a child is very sensitive to smells. And then specific strategies that we use at school, and then some that you guys can try at home if this is resonating with your learner. So at school, we'll do the use of scent breaks if the child is open to this. So like scented hand sanitizer, that might be where the scented Play-Doh come in, aromatherapy. So essential oils, if we have a student who is a very strong olfactory seeker, maybe we'll use an essential oil on a little pillow or a little stuffy or a little cotton pad that they can smell if they're really seeking that in the moment. This is also something we can do for a student who might be more avoidant. You know, we'll introduce like a scented hand sanitizer a little bit more gradually. And we'll also all offer a scent-free environment in the classroom. So if we know that the class is going to do something where there's going to be a lot of scent, shaving cream is a good example of this, where sometimes it's just heavily cologne scented or perfume scented, and we can't really avoid that. We can offer the student a space in their environment to get a break from those smells or avoid those smells. So again, we're really accommodating their sensory preferences and their sensory needs, not explicitly trying to fix it or, you know, kind of force them to engage in those activities if those are going to be upsetting to them. And then the home, you could try using scented or unscented lotion, depending on your child's preference. Scented markers, if you have younger learners who are really into coloring or scribbling, or you have some older artists who love drawing and things, you could try different scented markers. Those are always really fun. And then smelling games at home, like guess the scent, like different herbs or fruit peels or spices. You can kind of hide them in a bag or hide them in your hand and have them smell it so that they can, you know, practice getting exposed to different smells. And so this would be a good one for both a hyposensitive or hypersensitive if you're wanting to you know, gradually expose them to different scents. Or if you have a kid who maybe right when they get home, they're looking to smell something right around dinner time, you can kind of keep them occupied with this little game. All right.
All right, so that's a good transition into taste, because a lot of times kids won't maybe are more picky because of how the food smells. Like the smell and taste do go hand in hand. Um, so a child that is hyposensitive to taste may lick or chew everything because they really crave that taste sensation, or they have a lessened um taste stimuli, or they may also constantly put stuff in their mouth to get um sensations orally, um or they may just like stuff food in their mouth because it feels good to them and is satisfying for them, to help regulate. Alternately, kids with who are over responsive to food as well as oral stimulation may dislike having their teeth brushed. And certain food or textures, they may gag easily when eating. And then also preferring to eat food separately and not together. And just in general, more fussy eaters because they may not like the different textures that they taste. Or it could also be they may not like the smell of a food and then they're just more picky. Yeah. Now, so in the school environment for kids that tend, this is the next slide. Okay, thank you. So in the school, we use chewies for especially younger kids who like that oral sensation. And instead of this helps them so they're not like mouthing all objects. And then just providing them preferred foods at snacks so they can be as independent and like interacting with their classmates and what they're doing. For older kids, maybe chewing gum might be an alternative because a seventh grader wouldn't want a chewy. Or even there are necklaces that kids can chew on as well. Water bottle caps, stuff like that. At home, you know, just encourage kids to eat a variety of foods, even if they only touch or taste the food. I think that that's super important. Oral motor exercises. So if they have a lollipop, they can practice moving their tongue around and doing that. I know speech therapists do that as well. And then just using divider plates so kids can separate and choose which foods they want to mix. Okay. So for auditory, I'm going to get into auditory now. So a kid who might be under responsive, to sort of compensate for this, they may hum or speak in a loud voice or whistle. They also may miss verbal instruction just because they need more intense auditory input to register. And they also just may struggle in general with like fast-paced conversations because they have difficulty registering the auditory input. For kids that are over responsive to sound, you may notice this at home. They may feel distressed with fans, hand dryers, watches, or washers. I know that sometimes kids are also, if there's an automatic toilet that flushes or a hand dryer, that can also be hard for, like, kids have to learn that that's okay. Overwhelmed and disorganized in noisy environments, if they have a lower threshold for this, a smaller cup, then they just might not be able to, they may need accommodation to function better. And then they may produce sounds to dampen out other sounds. So if the class is singing a song and it's too loud for them, then they might hum or maybe tap their hand or something to compensate. Or another common one is just covering their ears if it's too loud. So strategies for under responsive kids: limit information presented. So to just make it clear for them to understand. So slower conversations. The use of headphones is good. Preferred music to help them concentrate. And then just alternate sensory inputs. For hypersensitive kids, I think having quiet workplaces, maybe playing white noise in the back, which, if you don't know, it's just basically like a constant hum. And I know, like, you can find it on Spotify. And then headphones or earplugs. So I'll get to what we have in school on the next slide. So in school, a lot of times we have noise canceling headphones. Teachers sometimes play calming music as the students work. I do that sometimes during my sessions as well. And then, of course, just a quiet learning environment. At home, pretty similar, using noise canceling headphones, earbuds or earplugs, as well as picking music that can help your child focus more. And then the use of white noise or noise canceling machines. So it's really just figuring out what your child needs, right? Because we're all different. So it's figuring out their preferences and what works for them. There's a question. Hold on. Do you mean low registration? Oh, you're saying low registration at home versus hypersensitive? Okay. I think I think if, you know, so um, like at school, you would just provide directions more slowly, and then also, um, also you would give them like ask. Do you guys have ideas?
Yeah, you know what? I think this question, why don't we save this one for the end? Because I think some other pieces might come up that we'll touch on when we answer this one at the end. But it's a good question. So
Yeah.
we'll come back to that one.
Perfect. And yes, please do feel free to just keep dropping the questions into the chat and we will definitely get to them. So our next sensation we're going over is tactile. So our sensation of touch. So we have our under responsive individuals.
That's fine. You can log out here.
We might see reduced sensitivity to touch. So, you touch their arm, they definitely don't notice. Just like a slight touch, they're not gonna get it. They might have like their clothes are twisted on their bodies. So we see this a lot when individuals just don't know that, their shirts are on sideways, various things like that. Pants are backwards. They may have decreased awareness. So we do see this in our messy eaters, dirty hands. They're not quite seeing the mess on their hands or on their faces, or they're not feeling it. But they do tend to seek touch. So we see our individuals who graze the tops of tables. They graze anything, honestly, they can get their hands on because they're really looking for a little bit more of that stimulation. Then we do have our over-responsive individuals, are hypersensitive. We call this tactile defensive. So, we've all had a shirt that has that tag that just bothers you. But for some individuals, it can be like a fire where we see that there's just that increased response there. They may avoid messy play. They may not like cuddling just for that over response to touch. And they may dislike clothing tags, as I stated before. So we do have some strategies. So for our under-responsive individuals, we want to offer them messy play. So whether that is, putty or maybe some slime, we have, mud when we're at home. We'd love to provide mud at school, but maybe most people wouldn't like that. Various things where we can see them getting into it, offering them also like maybe cooking. We can then also offer weighted blankets to help with that. If it's a blanket, a vest, or a backpack, just to help give that extra touch and that extra weight. For our individuals who are hypersensitive or over-responsive, we can introduce textures gradually. So we all have things we like and don't like. But again, that slow, gradual texture that they're willing to engage with, that's how we want to go about helping them not have that adverse reaction. Alternatively, we can also have them wear gloves, so there's less of that unwanted tactile stimulus. We can also prepare them ahead. So what this looks like is, really cueing them verbally, letting them know, really front loading. Hey, we're going to be doing this. Here's a towel. We can, as soon as you're done with it, you can wipe it off. And also have a towel. And then also deep pressure activity. So what that would look like can be like squeezes, things like that. And then specifically for in the home and at school. So at school, what this looks like is we do offer messy play. So whether that is water, Play-Doh, paint, finger painting, things like that, something that just gives a little bit back. We do offer weighted blankets, vests, and backpacks, whether that's in class to help with regulation to attend to an assignment, or if it's a sensory break that they may need to go to like a quiet corner. We offer arm squeezes. So again, it's usually an open hand, trying to apply just a good solid pressure to help with that regulation. And also bear hugs. Within the home, we can definitely address tags on shirts. There's a lot of adaptive clothing and even just clothing in general. I know none of my shirts personally have tags, that we can cut them out. We can get the ones that specifically don't have tags. We always like to introduce sweatpants versus jeans. If there's a seam that is really just quite irritating, switching out your jeans for sweatpants, and just kind of playing with that fashion. Then there are couch cushion compressions. These are some of my favorite. So being able to apply that pressure in a more solid manner. You just kind of take the cushion off your couch and you can do the same thing as we would do, say, like in a clinic, not usually at school, but having that solid compression there. And then also, again, offering those messy play activities. And I think I briefly mentioned it can be cooking, it could be playing in the mud outside, it could be playing in the bathtub.
All right. The next one that I'm going to talk about is the vestibular sensory system. So we've kind of gone through the five sensory systems that a lot of us are pretty familiar with, and we're going to get into the three vestibular, proprioception and interoception next. So, the vestibular sensory system is a very fun and interesting one. This is the one that is kind of all centered in that like inner ear canal. So these are related to balance and kind of also understanding where your body is in space. So for our kids who are hyposensitive and under responsive, we see these kids really seeking out jumping, climbing. They like being upside down. They might like climbing up really high. Again, related to that all that inner ear vestibular stuff. So being upside down, jumping up and down, changing their body in space is really fun and regulating for them. We'll also see sometimes that these students don't really have a sense of danger or it's decreased. So we might see kids who like to climb really, really high up on the playground and just jump off because that's a really fun, cool sensation that they get from it. And then they terrify all the rest of the adults at school. So we see that sometimes. These kids love spinning. So the vestibular input is often greatly given by spinning on a swing, spinning on a rotating platform. So if your kid is ever at the park and there's one of those little like merry-go-rounds and you just see them keep going and like they never get dizzy, these are our sensory seeking vestibular friends. We sometimes see decreased seated endurance just because, again, kind of sitting in that one plane of motion isn't really regulating and they're really seeking out having their bodies in different positions in space. And so we will often see that these students are rocking back and forth in their chair, they're constantly moving, they're fidgeting. They might be the student who's getting up constantly to go from one point of the room to another just to get their body in motion. On the flip side, for our hypersensitive kids who are over-responsive to vestibular input, they can be really fearful of heights. They don't like when their bodies is feeling that change in sensation with being higher up on a platform. They will often be what we consider gravitationally insecure. So these are students who really don't like being upside down. You could put them on like a yoga ball and like tip them forward and they're not having it. These are kids who will get on a swing and their feet will never leave the ground. They just kind of keep them there, maybe sway back and forth because they feel really insecure when their body is in a different plane of space. So we'll see that a lot. They might prefer laying down, being still. So you can kind of see that we have very opposite ends of this spectrum here for vestibular input. And then we'll also see that balancing activities like standing on one leg, standing on one foot kind of thing will be harder for them because again, their body is moving in a different plane of space that they're not used to or that they're very gravitationally insecure with. So strategies that we use for kids who are hyposensitive, under-responsive to vestibular input is we will really encourage regular movement breaks. So we'll really encourage that this happen all throughout their day so that they're getting this input in a more safe and maybe more appropriate way than like climbing to the highest point of the playground and jumping off. We will, give them some alternate seating options. So these are the kids that we might give a wobble stool to, a wiggle cushion, and things like that. For kids who are over responsive to this type of input, we'll really support them when they're balancing to really help them not feel as so insecure when their body is moving. And this is just a way that we can be supportive and helpful and encourage them that it'll be okay to move in different kind of positions and that they're safe. We will support their feet on the ground when they're seated. So especially if we have a smaller student whose feet maybe won't reach the floor yet, we can put like a little platform or a little step stool there so that they really feel very secure where their body is. We'll introduce movement really slowly, so allowing the student to kind of control the pace of what happens. And then we'll use some self-regulation techniques, which can include, using a safe space if they feel really overwhelmed by some vestibular input. We might give them that deep pressure, maybe a weighted blanket, or like yoga ball squishes and things like that to really help them feel where their body is in space and to help kind of regulate if they've gotten a little bit too much vestibular input. And then so for school and at home, we, again, in school a lot, we will use alternative seating. So move and sit cushions. We have students who use like an exercise ball. Again, those wobble cushions are really successful for kids. Even like the exercise bands around the bottom of their chairs. There are little things that we can put on the legs or the feet of the chair so that they can rock back and forth, but do it in a safe way. So it kind of stops them from tilting back and being at risk of falling. We utilize swings, the playground swings a lot. That vestibular input, like I said, swinging back and forth and spinning is such a great way to get vestibular input. So if a kid needs a movement break, we might suggest that they go take a break on a swing for a couple minutes and get that input and then come back. And they're often a lot more times regulated. So at home, swinging, we can't recommend it enough. If you have access to a park, or if you have even like a little swing in your backyard, if you have a student who is really seeking out that vestibular input, that is a great way to get it. Doing somersaults, just some tumbling, again, moving the body in space in different positions. Balancing on an exercise ball is an easy one to do at home. But also just hopping and skipping, making some hopscotch with some chalk, especially as the weather warms up, although maybe not this week, but maybe next week when we're out of the rain. That's also really good. Again, using one leg, one foot to kind of stand on and hop and switch positions to get that input, and jumping on a trampoline. All right.
Okay, the next sense we're going over is proprioception. So just to kind of get a better, more tangible definition, it is the perception and awareness of the body and movement. So I always learned it as how your body moves through space and being aware of that. So what we might see with individuals who do want more of that proprioceptive input, or we just see this in general, they crave rough and tumble play. So whether that's wrestling with each other, rough tag, various things like that. They may pull, twist, chew, or bite non-edible things. So again, we're looking for that kind of more awareness of where your body is in space, specifically your mouth there. They prefer snug clothing because again, it increases that awareness. They often break toys. So they may be using more pressure than intended. So say they are playing way rough with things, that lack of proprioceptive awareness sometimes will we'll see that in how they are with their toys, how they pet animals, things like that. So it's that kind of heavy pressure. We commonly see struggles with fine motor skills. So here's where that comes in, and it may appear, say, like heavy-handed. So some strategies here. We really like to provide access to regular movement breaks, say, throughout their days, whether that's a video, whether that's taking a walk, various things like that. We also like to ensure they have access to sensory tools, be it swings, trampolines, scooter boards, or a therapy ball. So all of these are utilized within school where that we are getting more of that, again, awareness of where your body is in space. And I know it kind of is similar to the other one, but this is more of like the feeling of it versus the balance aspect. We provide fidget toys, making sure that they have like foot fidgets, finger fidgets, various things like that to really get that feeling there. Sometimes they have special or alternative seating, which can be, again, therapy balls, wobble cushions, because this does allow for us to have that alternative seating that meets those needs for the increased proprioceptive input. Another thing we can do to increase that would be like promoting drinking cool water for a little bit of regulation there. It can also allow chewing of crunchy foods or ice, say to support regulation and alertness. We also might see deep pressure, particularly at times the child needs to focus, and then utilizing weighted equipment. So then specifically within the home, again, we really do promote those sensory breaks, which include those arm squeezes, chair push-ups, or self-hugs. For these, it's tools that we can teach the children, we can teach aides if they have aides that are assisting them, or we can also teach the teachers because then they can use it with the whole class or with each individual. Then we also have the use of weighted blankets, which, we will consult with that. And then other heavy work. So in the class, what that looks like is sometimes helping to move around chairs or, oh, can you take this bag of books to the other side, giving a purpose to it, but also allowing that regulation. Within some home, at home, what you can try is say like tug of war. So whether that's with a rope or with some pulling toy, that increased proprioceptive input where they're getting that various pressure there can help with regulation. We can also try animal walks because we see that we are on usually like all fours. We're increasing that movement and force through our body, as well as we can promote, say, climbing on the jungle gym there. The next one we have is interoception. So interoception is the process of sensing signals from the body, say like your heartbeat, breathing, hunger, or the need to go to the bathroom. Also pain. So we do see the internal sensations. So kiddos with interoception difficulties may display the following. They might have excessive eating or not feeling full because they lack that kind of sensation. Also, they may, similarly, they lack an appetite. So they're not really quite there. They don't know when they're hungry and they don't know when they're full. Another one they can be is they're unaware of feeling poorly, hungry, thirsty, or needing to use the restroom. We often see individuals being unaware of their temperature regulation. We can see our kiddos, their faces are flushed, they're still wearing their jacket, but they're not quite aware that they're too hot and they should take off their jacket. So kind of that lack of awareness. Similarly with the toilet, they're not quite there where they can tell you, oh, I need to use the restroom. So here are some various strategies we like to promote here. So deep breathing, it helps us be aware of our breathing, kind of how your chest feels when it's breathing in and out. So it's increasing that kind of awareness there. Similarly, diaphragmatic breathing, which is you breathe in through your nose and then you purse through your mouth to really help with that expansion and use of your diaphragm. We will also do body scanning exercises. So it's kind of running the kiddos through, say, ooh, like pretend there's a warm light on top of your head. Can you feel it on your nose, on your shoulders, in your tummy? So doing a full body scan and helping them kind of imagine that so they can get a better idea of where their body is and how it's feeling. Similarly, we can do mirror exercises because as we know, it's more of they can't quite feel what's going on there. So we're giving them more of an idea of, oh, can you feel this? Can you feel that? Tongue touch and texture exploration. So just again, giving that kind of sensation where we can, oh, this is cold, this is hot, this is soft, this is various things, just to give him those opportunities and increase that awareness. You can also do yoga, as you can then feel your muscles bend, you can feel your body move in certain ways, heavy work activities, and deep pressure. So as for specific strategies within the school and home, so frequently at school, we'll utilize timers for bathroom breaks and meal times. So when an individual doesn't have that sensation, we want to help them, say, with the dignity of not having an accident or just ensuring that they can stay dry and comfortable. So utilizing those, ensuring that maybe we are keeping track of how much liquids they're drinking, and then taking them on a set schedule and break. We can always do body check-ins. So if we see an individual's feeling particularly dysregulated, be like, okay, let's see, how are you feeling in your body? Are your shoulders tense? Are your neck tense? Different things like that. Body awareness games. So we just kind of change it up and we make it more of a game, kind of like the body scanning, but a little bit more fun, as we just I talked about earlier. Mindful breathing, whether it's following a video or we're all breathing together. We do a lot of the ones where you sniff the roses and blow out the candle. We promote movement breaks. We frequently use zones of regulation. So this is a commonly used chart, which basically will state for a child on what scale, according to colors, are they feeling, and this is to help them get a better idea. There's pictures associated, there's examples associated, so it helps them to identify those feelings, emotions, and what that can look like for themselves, as well as for the teachers and adults that help them. Additionally, we provide proprioceptive input for that. Within the home, we can also promote daily body scans. Everybody can always benefit from having a little bit of self-perception of what they're feeling. So doing that with your children at home. Having that proprioceptive input at home. So whether that's like joint compressions or say you guys are doing heavy work together, you can have them take in the groceries. You guys can, move a couple of things around. Oh, let's clean up our toys and push the box this way, push it that way. Often I'll have parents just put a bunch of laundry in a laundry basket and they can push it all the way across the carpet. And that's one of my favorite ones. Utilizing timers for bathroom breaks. So whether that is, again, helping with potty training or just trying to stay dry. And then also establishing a routine and predictability. So a routine for using the bathroom, a routine for when we're eating, various things where we know they lack that sensation, ability to tell. We want to make sure that we're promoting that with the use of routines and predictability.
Okay, so now we're just gonna wrap up. Before questions, I just wanted you all to think about how do you currently accommodate for your child or yourself, your sensory preferences now? And then after hearing this presentation, is there anything that you plan to take away and use at home with yourself or someone else in your home? You just think about that. So.
All right, well, that is the end of our presentation. We hope you learned a lot. There was a lot to cover, and yeah, we just thought it would be really helpful for you to learn and understand the different sensory systems and get a little slice of what under responsiveness and over responsiveness might look like. We have some time left, so we're going to open it up to questions, but I think we'll start with the ones in the chat first. All right. Let me stop sharing my screen so I can see. Okay. All right.
Hi. I just want to thank you all for wonderful presentation and for all the information and helpful tips for home. Would it be helpful if I read the questions one by one to you guys?
Yeah.
Like I know we went through